One thing that we've been very proud to say here at Pod TV is that we've got a number of shows that are making sure that people are not getting scammed and are not getting harmed by a lot of situations and everything like that. As a matter of fact, earlier today, we had Dr. Patmos with Science and Medicine, and he's been talking about some of the things that are going on in the science world for a number of years and all along those lines. And definitely, we've got Irene Parker, who does a whole show around timeshares and the scams that go on in that industry. But we know that there's another industry that has been definitely hit by scams and all along those lines, and that is the whole Medicare industry. And I met this young lady who's going to be starting to do a show with us on a regular basis when she was a guest on our World Edition show. So we're glad to be starting Medicare Moments with Toni, and she's going to share a little bit about what she's got going on and how she has been impacted and all along those lines. Because this is a very important issue, and it's the one that is impacting a lot of people and everything like that. So I'm glad to have you on the show, and for folks to learn more about how you got involved in this whole industry and then trying to make sure that people are not being scammed by Medicare and everything like that. Because we do know that it is a big issue. I mean, I'll be turning 65 on not this coming July. I'll be 64 this July, but on next July. And we do know that as people turn 65, 10,000 Americans will turn that age every 10 years and everything like that. So I'll be joining those ranks on next year and everything like that. So this year will be 64th birthday, but next year I'll be joining the ranks of the 65. And I know a lot of people that are 65 are still working. As a matter of fact, I was doing one of my jobs earlier. Of course, in addition to Pod TV, I work at a cultural arts center, and I also do some testing. And I've got some friends of mine that are still working in the testing company well into their 80s and 90s and everything like that. So I do know that it impacts a lot of people, particularly with work and everything like that. So, Toni, just share a little bit about how you got involved in this particular issue and all along those lines. Because, like I said, I'm definitely looking forward to us trying to make sure people are not getting abused. And I know that that's something you've been doing with your organization and your columns and a lot of other things for a while. And it all became, yes, you got caught up in the situation, I think, because of a family member and everything like that. So just share a little bit about your situation and how you got involved in this fight.
How I got, people just need to know my name is Toni King, and my website is tonisays.com. So if you want to ask any questions, you can email us and we can answer your questions. But how I got started, I was doing workshops for an insurance company in Mississippi,
Okay.
of all places. And I'm from Texas. Okay.
Mhm.
Okay. So I moved to Mississippi just to help my ex husband start building houses. And little did I know that someone would come to a workshop, and I'm not going to mention insurance companies because I'm not promoting anybody, any insurance companies. But this gentleman came to my workshop and he didn't need my help. He told me he had Part A, but he dropped his Part B and he didn't need it because he had company insurance. Well, he had been using the wrong wording when he called Social Security. He was on Social Security disability and he had retirement benefits. And they told him to sign the back of his card and send it back in so he could drop his Part B because he did not want to pay for Part B. There's a premium for Part B. He got on Medicare in October. November, he went in the hospital, had a stent put in his heart, and owed over $10,000 because he was on retirement benefits. He used the wrong word. And I took what's called the Medicare and You Handbook
Mhm.
and wrote a book explaining Medicare Survival Guide. Now we've got a online series that's called Medicare First Steps, but that's how I got started because I knew what the answer was. He gave Medicare the wrong word. He had retirement benefits, not company insurance. He wasn't working. And so I told him, I said, you better get in your car. His name was Mr. Davis. I said, you better get in your car and drive to the local Social Security office and re-sign up for Part B of Medicare. He
Wow.
did that because he was on his what they call initial enrollment period, which is when you're turning 65.
Mhm.
It's 3 months before the month you turn 65 and 90 days after. So, Mark, this will be you in a year.
Right.
And if you are on individual health insurance or have no health insurance at that time, then you need to enroll in Medicare Part A and Part B, whether you want to pay the premium or not. So I told him to get in the car because he still had 90 days after his Medicare, his Medicare started in October. So he had 90 days that he could enroll in Medicare, or he'd have to wait a whole year and get a penalty.
Wow.
Medicare does not know how to enroll you. They don't do the enrolling. Social Security does all the enrolling for Medicare. And it was an absolute disaster for this gentleman. But it gave me a purpose, and that's my purpose. Now I write articles in various newspapers, and you met me through the articles that I write.
Yeah.
And I mean, there's just different situations that can totally confuse people. Right now, there's not 10,000 turning 65 a year. There's 10,000 turning 65 every day.
Every day. Wow.
Every day. So you just get bombarded. And the call centers are coming from India, China, whoever. And they can't wait to get you're a walking dollar sign. They can't wait to get your Medicare.
Well, one of the things I didn't tell you the last time we did a show and everything like that is I've been involved with the VA for a while because a friend of mine started a show that is a music variety show that's based on the Apollo and everything like that. The Apollo, the famous Apollo in New York, but it's also a veteran advocate show. Captain Newborn started this about 11 years ago, but he started his organization, Next Level Veterans, even before that and everything like in that space. But I know that he oftentimes talks about the abuses that go on in the VA and everything like that, because that's part of what he is a veteran advocate, and his name is literally Captain Newborn, even though he never served in the military at all and everything like that. So that's just one of those ironic things in terms of people naming their folks and everything like that. But I know that sometimes people are concerned about VA benefits and how Medicare plays into that. So could you talk a little bit about that? That's why I bring up Captain Newborn and this VA thing.
Well, I think that would be a whole different show if we talked about VA benefits, because veterans need to look at their situation and see what they need to do. If you're going to doctors outside the VA, then you may want to sign up for Part A and Part B when you're turning 65 if you're not working full-time with true employer benefits. So you're a veteran. I mean, I think you're a vet, right? You were in the service.
I'm not a vet, but my dad was a vet. My dad was a vet.
Okay, but you weren't.
I was
not.
So
we're going to have to look at you in a year, or we can do a whole show on a situation like yours. If you're self-employed and you are not, and you're working, but you have a healthcare.gov account, you've got an individual health insurance plan, you want to get on Medicare because there's nothing any better than Medicare. I'm on Medicare, and it's been the best insurance I've ever had. I don't do Medicare Advantage plans on myself. I'm on a Medicare supplement because when you first get Part B of Medicare, you have a 6-month window that you can get a Medicare supplement without having to answer one health question. And that makes a difference. I mean, there's a lot of different rules. So, if just to make it simple, for people that are turning 65, if you're getting your Social Security check, you will automatically get your Medicare card. That'll come your way. That's what happened to Mr. Davis. He automatically got his card. And he's like, I don't want to pay for this. Well, he messed his whole self up. If you are not on employer benefits because you're working full time, then it's a whole different ballgame.
What do you say to Toni? What do you say to those folks, and I kind of alluded to it earlier, that are still working past 65 and wondering whether they should enroll in Medicare rules when retiring or laid off? Because like I said, I know for a fact that one of the companies I work for is a testing company. They can test end of the year scores for various high schools and grade schools and things along those lines. But I do know that there are some workers that are coworkers of mine, and it used to be I would see them when we were all in one place. Now a lot of times we're doing it remotely and everything. But some of these people are working well into their 80s and into their later ages, and even I've known some people working into their 90s, and they may be afraid to get into Medicare because of the way that it could impact their employment. It's kind of like the way people talk about Social Security and stuff like that. So, what do you say to folks that are
It all
working?
depends on if you're working full time with employer benefits. That's the main situation that you need to look at. Are you working full time? Are you working with a company that has more than 20 employees? Are you working full time? What's your situation? If you're not working full time and have their employer benefits, then it's a whole different ballgame. They've got on page 21 in the Medicare and You handbook, it gives you all the different, how many employees. If there's 100 employees or more with the company, then you can delay your Part B for a later date. Medicare is based off of income.
Gotcha.
And it depends on, are you married or single?
Yeah. And a lot of these people, there were a number of them that were, yeah, and that makes sense. And a number of them were married that were working in those later years and everything like that. And it is a large company. It's got probably thousands of employees, if not hundreds, and everything like that. But yeah, for a lot of people, it is supplemental income because it's not a job that you can maintain full time and everything like that. Because I think it's dealt with the testing company. So a lot of times there's only a 3 to 4 months window of actual active work. So a lot of people are trying to figure out how it would impact their Medicare and their Social Security as well. I am going to bring in, just because she's here and she's one of our founders, and she was very excited about you doing this show and everything. So I just wanted you to meet Kimberly Calhoun. Kimberly Calhoun is one of the founders of the network.
So just to let you know, I turned 65 this year. So I've been taking the seminars and classes and just trying to learn all the different options and what to choose and things like that. So I'm glad to see something like this. So confusing. I'm so mad at the government because I think I saw a piece of paper the other day. We have choices A through N, I think.
That's a Medicare supplement. So we can use you as an example.
Yeah, let's do.
Okay. So when did you turn 65?
I turned 65 in October, so I need to start working on my decisions. They said I needed to have a choice by June, 3 months before my birthday.
So you turned 65 this October?
Yes. Yeah, I have not turned 65 yet. So I'm working on what I need to do.
Then you really, after the call, you need to call me. Okay.
Yeah.
I mean, normally when I do a consultation for people, I charge a fee for the consultation. It's not a big deal, but it saves people a lot of money for what they need to do. Medicare's not free. So
it's not easy
either.
It's very complicated.
Don't get into there. Go on my website and pull up the Medicare First Steps, and it'll give you the basics.
Toni.
Or you just call me. Okay. You and I can sit down and I can show you what I do. But where's your benefits coming from?
My benefits?
Yeah, what insurance do you have right now?
I'm on the Obamacare. My husband died, and I was using his. And when he passed away, I had to scramble to figure out what to do. So I went on the nchealthcare.gov.
So you're on the individual health insurance plan.
Yeah, we're not employer type people here. We're all independents.
So are you getting his Social Security in check right now?
I am. Yeah, I did the math and it was better to take it than wait. So
okay. So 90 days since you're getting on Medicare in October, you got September, August, July, they'll send you a package and you'll get your Medicare card. I was having,
Are you
we got
okay?
allergies.
Yeah,
We got
yeah,
allergies. We
it's.
got, so
I've
you'll
been
get your Medicare card. All
Yeah,
right.
I mean, but I want to understand because there's just so many things that you can buy into. And if you buy, I mean, from the classes I took, they would say if you don't buy on time, you're going to pay a penalty. If you buy the wrong one, you're going to pay, a penalty. I mean, there's,
They use penalties so they can scare you to death.
yeah, but I mean, who's making up these laws and penalties? I mean, I thought that this, I mean, again, this is why I'm glad we have this show. I truly believe, I paid in all these years. My husband paid in all these years. I thought that they were not free, but I thought that there would just be something simple like when you go to other countries and they go, oh, yeah, you need health care. You don't need a card. We'll take care of you. We'll fix you up. And, no denials, no problems. And it's free. I've been paying into
free.
this.
Medicare is not free.
No, I'm talking about in other countries. They have medical care that's just accessible, very good medical care, and it's free. But in our country, I've paid for years into a system that's fine. It's still going to cost me when it's done. But there's, I mean, am I wrong? Is it A through N now? The supplements are A through N?
You're going to want, I mean, we'll have to, what state are you in?
North Carolina.
Okay. So we have to go with your zip code and we'll look at what plans are available there.
Yeah, but
you want to start when you're first getting on Medicare, you want to start with a Medicare supplement. Because once you get Part B of Medicare, you got a 6-month window that you can get a supplement and not have to answer any health questions. So if you got a health issue, your Plan G is your best option. I have Plan G. My out-of-pocket is $283, and I'm paying $170 a month for my Medicare supplement. Plus,
so you pay $258 plus $170.
No, it's once I hit $283, I don't have to pay another penny towards benefits. But it gets confusing because with Medicare, you got your Part B that you've got to pay, and it's based off of income. So if you're making income with Pod TV, then, it just depends. You're considered single, not married. So there's a whole different, to confuse people, it's too confusing. So we can sit down and go over it, and then you can see what's your best option. The best thing to do when you're getting on Medicare is to go to your doctor and find out what plans they like best.
That's a good idea. That's a very good idea.
Don't go to the classes. The classes are there to sell you something.
Yeah, I haven't bought anything, and I just sit and listen. I'm more of a study person anyway.
You can't buy anything because you don't have your Medicare yet. You don't have
right,
your Medicare.
But I didn't go to sign up for anyone to coach me or counsel me. I'm just there to learn. I mean, I'm the kind of person that I'm sitting here looking at this going, why hasn't anybody gone to DC and get rid of this? This is stupid. This is too complicated for someone who wants to just retire and not think anymore. And now you're worried to death about, did I buy the right one? I had a friend who did this, and it literally stressed her to death. Like, she didn't know what to pick, and she didn't have the income to pay for someone to consult her, let alone buy the Medicare anyway. She was living off of her Social Security only. And so when you talk about that, this program to me is the biggest scam in the world. Insurance is, because I get denied my treatment.
It's worse than Social Security. It's all about.
Well, at least Social Security pays. I get my check every month. That's one thing that I can say. I paid in, and they're paying me back. So I can't argue the Social Security factor, but. you
Hey,
know.
Tony, just really quickly, because I know you had mentioned it earlier as we were planning the show and everything like that. But how do people avoid the Medicare Part B penalties, and also the ones, because I know people
Yeah,
like you who have
the
got
penalties
prescription
are
drugs.
scary.
The way they do that is they sign up for Part B at the
B.
right time when they're supposed to. If you're someone who's getting your Social Security check, you'll automatically get Part B. Her Part B is going to start October 1st. Her Medicare Part A and Part B. If someone is still working and they might be getting a Social Security check, then we need to look at their situation. There's all sorts of different rules. If someone is self employed, like me, and you're self employed, Mark, more or less.
Yes.
If you're self employed, then we need to look at your situation. If someone can't afford to pay extra for a Medicare supplement, then we look at which one's going to be the best Medicare Advantage plan for you. Part C. That's part of the Medicare is divided into 4 parts: A, B, C, and D.
Right. And I know
And then there's a
A,
bunch more now. So because
no, those are your Medicare supplements. That has nothing to do. Medicare only has 4 parts. A and
Okay.
B is the original Medicare. That's your card. C is Medicare Advantage plans. And D is prescription drugs. Medicare has parts. What you're looking at on all those from A to N is the Medicare supplement plans. That's a plan, not a part.
Oh, okay. So there's a difference. Let's talk about this. There's a difference between part and plans. And what is the difference, and why is it so important?
Medicare got started July 30th, 1965, when LBJ flew to Independence, Missouri, and signed Medicare into law. And the cost of Medicare was $40 once a year. The premium was $3. Now, there's all sorts of different costs. I can't go through all the costs, but we've got thousands of dollars worth of costs. So a person needs to see what is their best option. If they say, you know what, I'm not sick, I don't care, I'm just going to go ahead and pay for my Part B premium, and I'm not going to sign up for anything. I don't need to go to the doctor. I don't need a prescription drug plan. Then they're just sitting there on top of a mountain and fixing to get penalties. That's another 30-minute call that we can do on that. So that's next week. That's what we can talk about next week. But right now, for people that are confused on Medicare, we got to find out what's their best option. Where is their best option?
And to understand this better, you have the parts, which are what we're entitled to, what we paid for, or majority of us paid for in our careers. And then there's the plans, and that's a supplement plan that you can buy that insurance companies are selling to people. Is that
correct?
Did I get that right?
Right now, when you're getting on Medicare, you're nothing more than a walking dollar sign.
Yeah, I can see
everybody wants your dollars. And they really push the Medicare Advantage plans very big. So
why did we make this so complicated? Why is it so complicated?
Because you've got you got insurance companies that market to Congress and market to the senators, and they get X amount of dollars, and it's all about money. Absolutely about money.
Because this whole thing is just insurance. It's just, and I go to other countries, and Nick has moved, one of our founders, and he is thrilled and happy. He pays $128 a month for him and his wife to have complete health care. They have amazing health care over in Spain. I know they have amazing health care in Albania and amazing health care in Greece. Nobody worries about these things. You just walk in, get treated, great treatment, wonderful doctors. I know because I've experienced them. And in America, we have to have insurance first. And I find it disturbing now, especially that I'm older and I don't want to think about it. Did I get the right one? Am I going to get penalized? Did I book it on time? I mean, it's
They want to confuse you.
my friend bought the wrong stuff, and then she had to pay a penalty of 48%. She's deceased now. She just passed away. I feel like the stress of all of this probably caused her to die, because it's stressful. It's very stressful.
Well, we can do a show on your friend Nick that's now overseas in another country. What happens when he wants to come back to the States?
He doesn't.
Well, he may someday. I mean, you never know.
I don't blame him. He is healthier than I have ever seen. I travel a lot, and I eat healthier. I feel healthier, and I'm considering doing the same thing he did, because it's just a healthier environment when you're in a country that does truly care about the people. And the doctors are just as educated as the United States doctors, and they're not worried about whether they get paid.
Well, the doctor can only spend, when you go to your doctor, they only spend 15 minutes with you because they got to go the next
year. I know, because they have to get through. And you know what's sad is and I learned this many years ago. I asked one of my doctors, well, how much do you get for each time I come in? It was my eye doctor, I think. And, I paid a premium of like $30 a month or something. And he said, I only get $10 for the visit. And then, whatever he might prescribe, and he only gets $10 for each visit. And then I realized my doctors, my general practitioners and surgeons and whatever, they have to fight for every dime they get. That's why it costs so much, because they have to hire admin in our country. And so the doctors are going down, and, we got all of this admin, and the insurance keeps all the money. So, I mean, I'm looking at a society with a system that is not intended for the health of the people who live here. It's intended for the wealth of the
insurance companies.
Yeah.
And exactly. We can talk about that next week as far as the scams that are going on.
Why isn't anybody going and changing? This whole plan could be changed and be so much better.
I don't know. Maybe you need to have a congressman on your show. We can just ask him.
Yeah, maybe we could do that. We just changed the laws. We're getting laws changed on another show. It's pretty cool. But that's the first thing I told them was, you can sit here and fight this problem all you want, but until you get the laws changed, we're not with it. It's just going to be a problem. And literally, we went to Congress and the Senate. We were only going to be speaking to 2. We ended up speaking to 25 or more. And it's going forward. The change is going forward.
Well, then let's let you and I talk, and let's see what we can do to help make changes. I mean,
because that makes, to me, it just doesn't make any sense the way we're doing things. I mean, people who need Medicare or Medicaid, they don't need to be thinking about penalties and fear and, oh my God, did I get the wrong one? And why did I buy this? I mean, I have an ongoing medical condition, a very, very rare disease. And, I have to fight all the time whenever the medical company changes. I have to appeal because they'll deny everything. They deny everything. And
yeah, I know.
So, and then, my doctors have to spend and they've known me. My doctors have known me for 20 years. And we found one treatment that works. It's not an experiment or anymore. It's been 20 years and it works. But they have to take time out of their schedule to appeal for me, to fight for me. And thank God they've known me this long. But they shouldn't have to. None of this should be a problem. And I think, Toni, that the people need to be dictating our health care, not the government. The government, I think if
then we need to stand up and fight about it. Do you want to make this longer than 30 minutes, Mark?
Oh dear, I'm sorry. I get on a roll.
We can make it a little bit longer.
Talarico is running for a position, and he's really big
Who
on
is?
making changes. James Tallarico out of Texas.
Yeah.
I love his position on the healthcare system. So I don't know. I don't think he's, the right person just yet. He's still campaigning, but yeah, I agree with you. Let's do this.
Yeah,
And I noticed
Mark,
we need the company phone number to call is 832-519-8664.
did you hear that, folks? Please write that down. Tony, can you
Right,
repeat that?
because the number that you got right there, nobody answers it.
Okay. So repeat the number again.
It's 832-519-8664.
And thank you, everyone.
Yeah. And the email is info@tonysays.com. TONI. I'm Tony with an I and not a Y because I'm a girl.
And there you go, guys and gals. If you need some help, Tony is very experienced. We're going to be talking about some of these things on the show every week. And we're going to try to get this broadcasted out to further places because I think that everybody needs to learn and understand this before you turn 64 so you understand what you're getting yourself into. But until we see you next week, 12 o'clock on Wednesday, please take care.
Yeah, looking forward to it, and definitely we'll be back having these great conversations. We can even have one about the prescription drugs and everything that we kind of touched on.
That's right.
But I do know that we're here in North Carolina, which is very much a prescription drug area and everything like that. So I'm going to go out with a commercial from a friend of mine that's in the legal field and everything like that. So we get ready to get out of here. But it's an amazing show.
Well,
Show that book once again.
Let me say one thing real fast. Are we gone?
No, we're not gone. Go ahead.
In your Medicare and You handbook, they've already made it for next year.
Okay.
I mean, if the rule changes or something changes, it's not in here. The only reason why they put out a Medicare and You handbook is so that you can see what Medicare Advantage plans are in your area.
Okay. And just so you let you know, do know that law that Kim was talking about, that's actually a law that they just enforced for the timeshare show. So yeah, these are things that we can definitely have conversations around, and hopefully she'll be in touch with you, or I can put her in touch with you, and we can make some laws that have changed what's going on that isn't fair in the Medicare field as well, because that is something that the network has already done. So there is a law.
I'm here for you, and I can answer the questions, and mine is not about you, but about me making a sale. Well, you got to do what's right for you. Okay.
All right, sounds good, and I appreciate it. Look forward to seeing you next week. And this has been a very good opening show where we got a lot of information, and Kim had some good thoughts and questions as well. So I appreciate you being on. I look forward to seeing you next Wednesday at this same time at 12 o'clock. I know we've got an investment show with Sasha coming up at 1 o'clock, but I do appreciate you being on.
I do. If you can give me a call, I need to talk to you real fast.
Yeah, I can do that.
Okay. See you later. Bye.
Yeah. Bye.
Are you looking for money-saving strategies for your business and personal finances? Are you tired of working hard every day with little or nothing to show for it? Contact Prosperity Financial Services, LLC right now for your free financial consultation. Call now to reserve yours today, 804-349-8600, 804-349-8600.